Hello, everyone, and good morning or good afternoon if you're joining us from the East Coast. Thank you for joining our webinar, Making the Link Between Stores and Suppliers, Overcoming Distribution Obstacles to Bring Fresh, Healthy Foods to Corner Stores. This webinar is the first in a series that we're calling New Carrots on the Block, presented by ChangeLab Solutions in partnership with the Network for a Healthy California retail program. We'll be covering a range of healthy corner store approaches in this series. Today's webinar will focus on how to identify distribution strategies to increase access to healthy food in corner stores, and we'll hope you'll join us for the next two webinars on public health partnerships and community engagement strategies. You can sign up for future webinars or listen to archived webinars such as our New Carrots on the Block series from last year at our website, changelabsolutions.org. For those of you who aren't familiar with ChangeLab Solutions, we're a nonprofit organization, and we use law and policy strategies to create healthy communities nationwide. We're also one of the co-sponsors of the Healthy Corner Stores Network, which supports corner store projects all around the country. And we're very pleased to also be presenting this webinar in partnership with the Network for a Healthy California retail program. The program provides fantastic support to neighborhood stores to inspire healthy change among consumers. We're very happy to have their support for this webinar. This is Lisa Chen speaking. I'm a planner at ChangeLab Solutions, and I work on a range of healthy eating and physical activity policy approaches, and I also have a public health background. And I am really excited to be joined today by one of our research fellows, Angela Hadwin, who's a recent graduate of MIT's Urban Planning Master's Program. She's also been researching distribution challenges and opportunities for the last couple years, and she's going to be sharing some of that research on our webinar today. In addition to her just amazing research skills, she also has a range of other skills that people may not be aware of. She, like myself, used to be a garden and nutrition educator working with youth in New York and elsewhere, and I just love to get tips from her about different energizer activities to work with youth and different songs about plants. And we are also so excited to be joined by two practitioners in the field who are going to be sharing some of their experiences really grappling with and overcoming distribution challenges. We'll first be hearing from Lindsay Palmer, who helps lead the DC Central Kitchen program. And we'll also be joined by Claire Fox from the Los Angeles Food Policy Council, who will be sharing her experiences working with corner stores in that region. So here's our agenda for today. We're going to be kicking things off with a brief overview of some of the challenges and steps to working on distribution strategies. Then we'll be doing our two interviews with Lindsay and Claire. And then we're going to have a little bit of Q&A time at the very end. And then we're following that with virtual office hours. So this is a new feature that you may have seen in an email over the weekend. We're actually going to be extending the time on ReadyTalk for another half hour after the webinar, and we'll be delving into some of the issues in more depth, and we'll open up the phone lines at that point so we can have more of an informal discussion. You'll also, if you looked at your email over the weekend and yesterday, you'll also see that we sent out a self-assessment tool that has some questions to kind of guide this discussion. So because we're on a webinar, and I know there's a lot of people out there, we wanted to kind of get the chat box moving. I wanted to encourage you that throughout the webinar, we will be monitoring the chat box. So if there are questions that come up, or if you want references to different resources, please type those questions in, and we'll try to answer them as we get to them. And we also wanted to just get your thoughts early on before we dive into the discussion through an interactive poll. So on the next slide, there are some responses to this question. Do you currently work with food distributors? So the responses are that yes or no, we're just starting out with our Healthy Corner Store program. The second response is we've talked with store owners and we've heard a little bit about distributors but haven't contacted any. The third response is we've tried reaching out to distributors but haven't had a response. And then the fourth response is we're actively working on implementing it. So we'll take a few seconds now for you to submit your response. All right, another 5 seconds or so. Great. So it looks like we have a pretty big mix. We have a lot of people who are just starting to get their feet wet and thinking about healthy distribution, but have not really taken the first steps. And we have a quarter of you who are actually already starting to work with developing a system or some strategy that will work in their context. That's great, and we hope that no matter where you are in this sort of spectrum, that there will be something in this webinar for you. So with that, I'm going to transition over to Ange, who's going to be talking about some of the challenges to sourcing healthy food in the small food retail environment.
Great. Thanks, Lisa, for getting us started, and thanks to our guest speakers for joining us, and thanks to everyone for being on this call with us. So why are we here talking about distribution and supply chains today? Well, healthy corner store programs, as you know, face several challenges in helping stores source healthier foods. As we continue to work to improve the access to healthy foods through the food retail environment, understanding how to best interact with distributors and other suppliers becomes increasingly important. Healthy corner store program managers are likely familiar with many of the challenges that small stores face when trying to source these healthy foods. Some key challenges that we've seen include accessing distributors, what we're calling the price, quantity, quality quandary, say that 10 times fast, and store owner capacity, in addition to some infrastructure challenges. Apologies. Okay, so as distributors get bigger through consolidation and more large retailers like Walmart own their own distribution systems, smaller stores may have a hard time accessing healthy food options at wholesale prices. In rural areas, there are often few choices for smaller stores and distributors can often pass by some of these small communities altogether. Many grocery store distributors have high weekly minimum purchase amounts, starting at around $5,000 a week or more. Suppliers also may not carry healthful or culturally appropriate food items. If stores can meet the minimum order, delivery fees, especially for harder to get to places, can make the cost prohibitive. Additionally, due to their small size, corner stores and other small food retailers are confronted with a set of trade-offs between price, quantity, and quality. As food access advocates, many of us want to get affordable, quality foods to small stores. But to get a better price, they either need to buy more products than they need or likely can store, or they may have to sacrifice on quality. Store owner capacity is another important factor, since selling healthy foods is often a significant shift in how these stores do business. Store owners may not have knowledge of which items are healthy, where to find and how to buy these items, and how to sell, market, and manage healthy foods, especially produce. Since many stores are staffed by 1 or 2 people, store owners also may not have time to invest in learning these skills or time to travel to visit wholesale markets. Cultural and language barriers can also inhibit trust in placing orders over the phone or doing business without face-to-face interaction. So, to help us start addressing these challenges, we've outlined 4 steps to start working with distributors. The first is assessing your stores to find out what the stores have and what they need. The second is learning about your local supply chain to know who the distributors and wholesalers are in your environment. The next is gathering your allies and resources, and this is really important to increase your leverage and ability to solve problems. And finally, exploring a variety of creative and appropriate solutions to address the challenges that you're facing.
Great. Thank you, Anne, for that really wonderful introduction around some of the challenges that are facing store owners. This first step in the distribution process, store assessment, is really meant to help you identify what some of the main challenges and opportunities are in increasing distribution of healthy foods to local stores. Those of you who are grantees of the Network for a Healthy California retail program are probably very familiar with one great in-depth assessment tool to help you start evaluating the retail environment, the Communities of Excellence in Nutrition, Physical Activity, and Obesity Prevention Survey, or CX3. The survey is available to download on the California Department of Public Health website. If you're lucky enough to have CX3 data collected for your stores, it can give you a great picture of what the overall food retail environment looks like. For instance, evaluating the availability of both healthy and unhealthy foods, marketing, and participation in federal food programs. However, there may be other questions that you'll want to ask store owners and other stakeholders in order to fully understand how local distribution works. What distribution strategies might be practical and economically feasible, and to gauge whether store owners are truly committed to making healthy changes. Potential stakeholders who might be helpful to speak with during this assessment phase could include merchant associations, food policy councils, and the store owners themselves. The idea is to get as complete a picture as possible of the main barriers and opportunities within the store owner's current distribution network, as well as to assess their attitudes and their willingness to work towards healthier options. Hopefully, all of this information can help you evaluate whether a distribution strategy is likely to be a good fit, or whether some other strategy or combination of strategies could be more appropriate.
So now that we've started to understand the needs of our stores, how do we go about starting to understand the supply chain? As Lisa pointed out, the best way to start learning about your local supply chain is by asking store owners. She also mentioned a whole host of other partners and ways to look at, to start understanding the supply chain, as you'll see listed here. And we'll also hear a little bit more about this from some of our guest speakers later on in the webinar. Now, wouldn't it be great if the distribution system looked like this? Fresh produce directly from farm to store. However, the requirements of stores and farmers often don't match so neatly. Supermarkets have worked hard to build a simple and efficient distribution system, increasingly with stores and distributors owned by the same company and with very direct supply chains. Corner stores, however, source from many different places depending on what is convenient and who services the area. They buy wholesale, but sometimes also buy from retailers as well. But it's rarely this simple, and the distribution system actually looks a little bit more like this. This is, in fact, also an oversimplification, but it gives you a sense of how complex and a little bit crazy the landscape of food supply to small and independent retailers is. As you can see, there are many pathways and many different types of suppliers that provide food to corner stores. To start to understand where small stores source foods, we will start looking at wholesale distributors, including manufacturers, you'll see in the top left, that deliver direct, and wholesale distributors you'll see on the right. So the best selection and prices, especially for healthy foods, will often be found with wholesale grocery distributors. But they primarily operate in large volumes with high minimum order requirements and mainly serve larger stores and supermarkets. On the other hand, convenience store distributors primarily service smaller stores, but the vast majority of profits come from tobacco products. The food these distributors carry is generally limited to a selection of unhealthy snack foods. Manufacturers also get product to small stores through direct-to-store delivery, a strategy commonly employed by makers of soft drinks, snack foods, alcohol, and baked goods. Through working more directly with stores, manufacturers employ a host of incentives and marketing strategies to have more influence in how their products are displayed and sold. A whole host of independently operated specialty food distributors also occupy the environment, including produce distributors. And these distributors will gather products from different sources and then redistribute them out to stores. Jobbers are a particular type of independent small-scale distributors, and they can range from sort of more established businesses to one individual and a truck who gathers produce or other items and distributes them out, mostly to smaller stores. Next, but many times, especially for healthier foods, stores cannot access direct distribution. So instead, they must spend the time, effort, and gas to travel to a fixed location seller, such as a wholesale market or even retail centers. Wholesale produce markets are a great source of wholesale produce with many sellers located in one place. However, these markets tend to only be located in or near major cities and are more common on the coast. Another common source of wholesale products are cash and carry outlets, such as Jetro or Pitco. Catered to small businesses, these wholesalers provide a range of products commonly carried by small stores. When stores can't find or access wholesalers, store owners will also travel to retail buying clubs such as Sam's or Costco's, or even go to big box stores such as Walmart or Target. For some store owners, the local supermarket may be the easiest choice for purchasing some food items such as fresh produce. Buying retail may be the best option for some owners, but presents a real challenge for food access since they then need to mark up their products above the retail prices they're paying in order to keep their businesses running.
Great. Thanks, Ange. As Angela has shown, the food distribution network is incredibly complex with tons of infrastructure, people, and logistics at really every link of that chain. So repairing or recreating the system so that small stores can really access it will require you to really think of what resources and potential allies can help you make the shift to a new healthy business model. Funding is likely to be one of the biggest barriers to making these changes, so we wanted to highlight a few resources that can help. Some of you may already be familiar with Green for Greens, the Healthy Food Retail Funding Guide that ChangeLab Solutions wrote, which is available on our website. The CDFI Funding Guide is another great source. Both of these documents profile a range of local, state, and federal funding sources that could support distribution and other healthy food retail strategies. Another great publication that we wanted to highlight is the USDA Food Hub Resource Guide, which focuses on federal funding sources that can support food hubs and other distribution models. It includes a great guide to what types of activities are eligible under different federal grants. However, allies can be just as critical to moving a healthy food distribution strategy forward. Successful alliances with distributors, businesses, and local government partners can provide resources, technical assistance, and political support critical to helping you design and implement your distribution strategy. Meanwhile, partnerships with community stakeholders such as food and hunger organizations, neighborhood associations, faith-based institutions, youth development, and other groups can help lend credibility to this process, solicit ideas and feedback, and hopefully generate business demand and ensure that the healthy changes are financially viable in the long run. Another potential resource might be other similar programs. For instance, a farm-to-school program, a food bank, or some other food and hunger program might be grappling with very similar distribution questions as you. They may be able to provide peer coaching or may even be a potential partner, allowing you to pool your resources and expand your reach, as we'll hear about from our speaker from the DC Central Kitchen program later today. One program that we wanted to highlight is in Columbus, Ohio, where food access advocates have done a really great job of not only garnering political and community support, but also financial support blending a variety of funds. So they've been successful in securing 2 federal sources of funding, especially Crop Block Grant, which is administered federally through the USDA, and a Community Development Block Grant, which is federal funding, which is administered through local communities. They've also been able to get in-kind support from United Way and from SNAP-Ed-funded nutrition educators to support their work. And what they're going to be doing with this blend of funds is creating a distribution network that will work with 6 corner stores in an urban area and also create a distribution network with local community centers in a rural community. And they'll be providing technical assistance, training, as well as a rented vehicle to create the distribution channel.
So now that we've learned about our store environment, explored the local supply chain, and gathered our allies and resources together, how do we start looking at addressing these distribution challenges? It's still a pretty new field, and people have been really creative and resourceful in developing these solutions. From our perspective, we've seen 3 types of strategies emerge: partnering with distributors directly, and getting the existing supply chain to work as effectively and efficiently as possible, shared or cooperative purchasing, where people pull together to be able to access some of these larger distributors, and developing new distribution models altogether when programs have found that they can't actually get the distribution system to work for their needs. So, as we've seen, distribution is complex and challenging, and seeking to partner with distributors can be a great way to make the best use of the existing system. Selling healthy foods through smaller stores presents a new and untapped market for a lot of these wholesalers. Distributors may be able to adjust their business practices better to better serve small stores by reducing minimum order amounts and delivery fees, selling in smaller quantities, increasing their selection of healthy and culturally appropriate foods, as well as providing technical assistance, marketing and merchandising support, inventory and product management, store design, and even data collection. In California, Unified Grocers, which is a large wholesale distributor for the western United States, was brought to the table as a partner in healthy food access as part of the California FreshWorks Fund initiative. As a result of this relationship, Unified decided to lower their minimum order amount from $5,000 a week to only $500 a week. Their Neighborhood Markets program now allows a whole bunch of smaller and independent retailers to access competitive wholesale prices for a full selection of healthy grocery items. In New York, the Shop Healthy program, as part of the Department of Health and Mental Hygiene, has partnered with a regional grocery distributor to promote healthy items identified by the department with a Good Choice logo. Using this logo, store owners can now find Good Choice items in wholesale catalogs and can also receive in-store marketing materials such as shelf talkers and posters directly from their distributor. Shared or cooperative purchasing is a good strategy to increase buying power in order to access distributors with high minimums or who sell in large quantities. Smaller stores can partner and create agreements with larger grocery stores, local institutions such as schools, churches, or hospitals, and other small stores through a small retailer association. People are still in the process of exploring a whole bunch of different strategies and options for cooperative purchasing among stores. The Center for Closing the Health Gap in Cincinnati, Ohio, developed a multi-pronged initiative in the Avondale neighborhood to address food access. They've started 4 corner store conversions and produce stands at 3 churches and 3 schools. As a partner in this effort, the school district has now agreed to allow access to their wholesale distributor and wholesale pricing in order to supply the produce stands as well as the corner stores. The Dixon Food Cooperative in rural New Mexico can't even get the wholesale delivery truck to stop in their small town, even though it regularly passes just a few miles away on its regular route. They just can't meet the $10,000 weekly minimum, so they have an arrangement to pick up an order from the same distributor at a grocery store in Taos, an hour away. It's less than ideal, but it's the only way this small town store can access wholesale groceries. Now, sometimes there's a gap in the supply chain, or sometimes distributors just can't provide what small stores need. In these cases, some corner store programs are developing their own distribution system. Perhaps there's a gap, perhaps they can't access distributors at all. Maybe they can't get the right size or price of orders, or maybe programs want to source local food. All of these are reasons to start exploring new distribution models. The DC Central Kitchen will be discussing a program-driven distribution solution later on in this webinar. And these program models are really important for connecting distribution to stores in a way that really helps support the store with wraparound services. Additionally, local entrepreneurs are coming up with new solutions to connect local farmers and suppliers to smaller stores. And they're bringing a whole bunch of technology-driven solutions, including local purchasing platforms or buying clubs. And finally, food hubs are institutions that are set up specifically to connect local farmers to local markets. And many of them are starting to explore working with smaller stores. Community Services Unlimited in LA offers fresh produce aggregated from local farmers and urban agriculture projects. This effort is based on years of continuing food justice work. Their youth and community-driven efforts started with urban farms and gardens, which then evolved into a farm stand. When the farm stand became so popular that they couldn't supply with their urban agriculture, they started sourcing from other local farmers. Now, with a vibrant supply of fresh produce, they have started to partner with local stores and other programs to create a local food enterprise, getting fresh produce to corner stores. I hope these examples have helped spark ideas about the realm of possibilities that are still being explored. We will now hear from our two guest speakers who will give us an on-the-ground perspective of strategies to improve the supply of healthy foods to corner stores.
Great. Thank you so much, Ange, for that really broad overview of a range of different approaches. I think as you'll sense on the call, this is a field that's very much evolving, and there's a lot of opportunities to get in there and create new and creative strategies, or to work to recreate systems that perhaps aren't working anymore for small retailers. So we're now going to switch gears and hear from Lindsay Palmer, who's going to be sharing some of her experiences really grappling with these issues on the ground. Lindsay Palmer is the Director of Nutrition and Community Outreach at the DC Central Kitchen, a leading nonprofit organization in the fields of hunger and food-related initiatives. For almost 3 years, Lindsay has managed the kitchen's contract with DC Public Schools, designing and implementing a pioneering approach to healthy, locally sourced school food. Currently, she is working on growing the program's Healthy Corners program, which focuses on food access in the food desert areas of DC while working on expanding the program nationally. Lindsay holds a BS in Nutrition and Dietetics from the University of Delaware and has completed her dietetic internship at the College of St. Elizabeth, focusing on food security issues in children. Welcome, Lindsay.
Thank you so much.
And thank you so much for being on our call today. So we have a few questions for you. First, we kind of just wanted to get a sense from you of just the what your program encompasses, just a brief introduction.
Great. That sounds like a wonderful start. So thank you, and thank you everyone for taking the time to sit in on this webinar. So DC Central Kitchen is a about 25-year-old nonprofit based in the District of Columbia. We've always dealt with food issues and food insecurity, specifically in the poverty-stricken areas of the district. In early 2011, the District of Columbia put out a grant to do a food access program. It had just done with another nonprofit a survey of the district to determine between the different wards of DC the food access issues, the poverty issues, obesity issues, and came up with the Feed DC Act, which tried to get local businesses, local nonprofits, and other community members involved in transforming the food layout of the district, more particularly if anybody does know the District of Columbia in wards 5, 7, and 8. The research data showed that most of the residents within wards 5, 7, and 8 were combating poverty issues, issues with food access, obesity, type 2 diabetes, and a whole list of again, other issues, mainly circling around poverty and food access. So we were awarded the grant in about mid-2011 to do a wholesale distribution center through those three particular wards, again, wards 5, 7, and 8. We started the program just a couple months later, had 30 corner stores signed up for the program. So the essential part of the program was signing corner stores up, as the one you actually see in the picture now, to do a distribution model of food access. We got 30 stores involved in the program. We were able to, with the grant funding, distribute some infrastructure. So that would be a tabletop refrigerator, some metro shelving, and some other stainless steel tabletops to promote the product. Some smallware such as baskets and other materials to hold the product so that it looks nice in the stores. Many of the corner stores that we're working in are in impoverished areas. Space is very limited, lighting is very limited, so we're really trying to get the product to look as nice as it can while it's on the shelves. A lot of the money also we were able to use for marketing materials. So as you see here, there's a Healthy Corner store sign. So we were able to put that on the metro shelving to really grasp the eye of the consumer walking through. We also worked with the store owners to get actual placement of the shelves in, so that they were somewhat near the beginning of the store, by the doorways, or other areas where it's well lit so you can actually see what the product is. So the grant lasted for about 6 months. We had a distribution model that started at month 1 and ended at month 6. So for the first 3 months of the program, we actually put together bundles of food. Very similar to the picture you see now, there was a set amount of product for each one of the stores that went out, and it actually went out free of cost for those first 3 months. And that cost was covered by the grant that we were given through the District of Columbia. After the first 3 months, so month number 4, we did a distribution model of 33% retail. So the store owners paid 33% of what the actual retail cost was that we acquired. Month 5 was 66%, and month 6 was 100%. So by the end of the grant, all 30 corner stores that were still in the program were paying 100% of the retail cost that DC Central Kitchen was able to procure from our different produce vendors. We worked with our large-scale produce vendor. We also worked with some local farmers. Many of our programs within DC Central Kitchen, beyond Healthy Corners, work with local farmers, as you would see here. These are actually Mennonite farmers from the Shenandoah Valley in Virginia. This was actually a USDA-sponsored co-op to do auction work with the Mennonite farmers. There's about 125 down in the Shenandoah. So we were able to bring some really great product in and actually have some really workable pricing between using local farmers and then also using our large-scale distribution vendor. Because DC Central Kitchen is a larger vendor in the area, we're actually able to pull in some better pricing than you would see in the grocery store or even from some of the cash and carries. But of course, those are always issues that we encounter when we were doing the program. So after 6 months of the program, the grant phase was up. It was about a $300,000 grant phase to, again, distribute fresh produce to about 30 corner stores in the food deserts of DC. At that point, the grant was completely over, but DC Central Kitchen decided to continue to do the grant through our own funding, just through an additional program of the organization. So actually what you see here is our nutrition lab. This is our large-scale production kitchen where we house Healthy Corners. with this new space that we actually opened the same summer that Healthy Corner started, we're able to bring in a lot more produce at once, which again is going to lower the cost of the product. So after the 6 months of the grant phase, we took on the program ourselves. We continue to do distribution of the 30 corner stores. We continue to work with our vendors to decrease prices and to get the prices that were actually in the stores to be comparable to what you would see in a grocery store. We continue to work with the store owners on technical assistance. They all receive additional marketing materials, signage, baskets, and if they need anything as far as additional refrigeration and shelving, we work with them to try to find some funding within the district or within private funders to work on that. So for the last about 18 months or so, we've been working with the program solely through DC Central Kitchen and through some of our partner foundations and funders. We have some private foundations, we have some public foundations that give us money to help support this program. We would consider Healthy Corners to be a blend of social enterprise and philanthropic granting. So a lot of what we bring in as far as actual pricing for the produce, what the store owners pay for the product through DC Central Kitchen, goes right back into the program. And then we also use some of the funding that we get from grants to help support things like salaries and transportation. I believe one of the vehicles that you actually saw in the picture is a donated vehicle from CoBank that does farm banking. So they were very interested in our program, specifically bringing local produce from, again, some of the regional areas such as Pennsylvania and Virginia, Maryland, into the district where there is very, very, very little local produce. So again, we've been working with our corner store owners to expand the program. We're hoping this time next year we have about 45 to 60 stores. There are multiple of corner stores within the District of Columbia, and many of them are within the food desert. So we're looking to expand the program to increase food access. One of the things that we know is out there is actually the need for food access, and the customers and the residents of DC want that. But it's not as easy as just distributing produce to the stores. Marketing is also a big piece of this. Getting the store owners to be active and engaged in the community is also a big part of this. I could walk down to one of the corner stores near my office and put bananas on the shelves. That doesn't necessarily mean they're going to sell. So we do a big marketing push. One of the great aspects of working with DC Central Kitchen and working with DC government is the partnership and the relationship that had been there for 25 years already. Most of the community knows DC Central Kitchen and knows our different programs, and that we're about increasing food access, decreasing poverty and hunger in the district, and that the mission of our organization through and through brings more things into the District of Columbia to try to, again, benefit the community and benefit the residents of the area. So being able to start up this program is one of the biggest reasons that we were chosen for the grant. It's also one of the biggest reasons that we continue to do this program, even though it's not fully funded anymore.
Great. Thank you, Lindsay, for that wonderful introduction, and what lovely photos. It's great to see not only the distribution network, but also just how attractive the displays look in the stores. And it's great that you've been able to continue the program and sustain it even past the grant period. I see that there are a couple questions coming in through the chat box, and I encourage people on the call to continue to ask questions, and if there's time at the end of the call, we'll take those. So the first question that I have for you, it looks like you've really developed this extensive supply chain for these 30 and plus stores. Could you describe some of the major challenges that you faced in really creating this system?
Sure. So one of the biggest things, even though we have a full-scale transportation team, was transportation. The district is very small. Many of these corner stores are in high-traffic areas, but also in very low public transportation areas. So we have a full-scale metro system and a bus system, but the bus system is actually what you're going to find more in this area. So for us, it was about getting the product out to the stores via our own transportation, and then also being in areas where there is public transportation for the customers to be able to get out there. But sourcing the product, one of the bigger issues is also the breakdown of the product. We don't sell many of our products in full case counts. So stores have the option, as you can see in one of the pictures, our driver actually loads up our vehicle, which is the picture in front of you now. Yep, there's Philip. He loads this vehicle up every single day with all the products that we sell and brings them out to the store. So the store owners have the opportunity to buy in piece count, which can make things a little bit more difficult, and also a little bit more difficult to purchase from our vendors. If the apples aren't the right size, customers are just as picky as they would be going to a grocery store. So if the price and the way the product looks doesn't work, then we're not going to sell the product. So really getting in touch with our vendors to understand what kind of products they have and what's going to work best for the corner stores in our retail program.
Great. And then another related question is, this is obviously providing a whole range of services that perhaps these stores would not be able to access by going to a larger distributor. So could you explain some of the rationale behind why DC Central Kitchen decided to create its own distribution system versus working with existing vendors and distributors?
Sure. I believe it was touched on before when Angie was talking about meeting minimums. Many of our stores are very small. They don't have access to a large street where a truck can actually pull up on. So we decided to do this on our own because we saw the need for it. Because of, again, of our transportation team and because of the distribution that we already have, it was a little bit easier for us to be able to break down the product, to get the transportation team out there, and actually cater a little bit more towards the store owners than a large-scale vendor would. Again, just hitting the minimums, the frequency of deliveries. If something doesn't sell in a store, obviously the store owner is not going to buy as much as the time before. And so we really wanted to try to break that cycle of the distribution issues by just doing it ourselves.
Great. And then I have one last question for you before we switch gears again. So in terms of the sort of long-term relationship with the store owners, now that you've had the initial cohort of stores and you're thinking of adding others, what have your findings been in terms of their willingness to really do the hard work it takes to be able to stock and move this product?
That's a great question, and that's actually one of the biggest issues that we have with some of our lower performing stores at the time. Store owner feedback and buy-in to the program is huge because a lot of our store owners are not as accessible as you might think. Many of the stores owners or just the people working at the stores are behind bulletproof glass. So it's very difficult to get in touch with the customers if you can't come from behind something that's actually a physical barrier. We also are working a lot with language barriers or different type of ethnicity barriers within our corner stores. So the store owner really does need to be willing and able participant in the program for this to succeed. For us, it's not necessarily us making money. It's about being able to break even and make the program sustainable. But for the store owners, we do know that it is about making money for them. If they're not able to make money, they're not going to continue to work on the program. We do have some really wonderful store owners that are about the community, and they understand how difficult it is for some of their residents, such as some of our stores that are actually in transitional housing. Many of them can't get to any type of large-scale grocery store, and if they can, it's far more expensive than the product that we sell or they're able to sell in the stores. So customer interaction with the store owner, but then also the store owner interaction with the community and with the customer is probably one of our biggest pieces. They have to, again, be willing to take the time to move product around, see what's not ripening the right way, see what needs to get thrown out. And unfortunately, some of the stuff does sit for a little bit longer than it should. But that's when we go back in and work with the store owner, give them some technical assistance, and then take a look at different ways of storing product to make sure that that doesn't happen.
Great. Thank you so much, Lindsay.
Thank you.
It really speaks to how multi-pronged your program is, that you have the capacity to work with the store owners long term, but also you're working on the marketing to the consumer and developing the system behind the scenes. So we're actually going to switch gears to our other speaker, but if you're able to stay on the line, Lindsay, we'd love to have you answer some more questions at the end of the program.
Great, thank you.
Great. So We are very thankful to have Claire Fox here joining us today. Claire Fox is the Strategic Initiatives Coordinator for the Los Angeles Food Policy Council, an independent nonprofit incubated by the Office of Mayor Villaraigosa. She works closely with the Council's network of food stakeholders to catalyze projects and build leadership capacity for sustainable and equitable food systems. Claire also manages the Community Market Conversion Program, formerly located at the Community Redevelopment Agency, which assists neighborhood markets to sell more fruits and vegetables in Los Angeles. Previously, Claire worked on green jobs policy research for the UCLA Downtown Labor Center and as a radio producer and reporter for Youth Radio and NPR. All her work is informed by over a decade of participating in grassroots movements for social and racial justice. Claire has a bachelor's degree from Mount Holyoke College and a master's in urban planning from UCLA. Thank you so much, Claire, for joining us. Welcome.
Thank you.
So similar to the format with Lindsay, it would be great if you, we have some questions for you as well, but it would be great if you wouldn't mind sharing some of the background around your program as well.
Absolutely, and I know we want to get to the virtual office hours as well, so I'll give a brief overview of our program so that we can get to the questions. So the Community Market Conversion Program is a project of the Los Angeles Food Policy Council, which, as Ange mentioned, is an independent nonprofit initiative being incubated in the Office of the Mayor in the City of Los Angeles. And the purpose of our program is to transform convenience stores and neighborhood markets in low-income neighborhoods with limited access to healthy food and support them in becoming good food community markets. And the way that we do that is we provide technical assistance, we provide financial assistance, and we broker community partnerships on behalf of the stores so that their store conversion projects are able to be sustainable for the long term. So the program began at the Community Redevelopment Agency, the CRA, here in the city of LA, which, for those of you who are not familiar with what happened with redevelopment in the state of California, it no longer exists. But in that was the beginning of our program. It really was created as an economic development initiative to invest in businesses in low-income areas and to support small business owners. The project started with a very bricks and mortar perspective of providing capital financing to do pretty substantive transformations both inside and out. And since the dissolution of the redevelopment agency, the Food Policy Council adopted the program to continue it. We are supported by a collaborative of community-based and community development organizations in LA who are engaged in social justice, food justice, equitable community development. And our collective goal is really to empower community leadership through the process of transforming the stores, as well as empowering the store owners themselves as leaders and healthy food champions, and ultimately to implement what we feel are comprehensive and sustainable market conversion projects that hopefully can catalyze further neighborhood revitalization. Since the program has moved over to the Food Policy Council, we have also built in a new aspect of our program, which is the Healthy Neighborhood Market Network, which is a platform for providing business and leadership development trainings. Because our store conversion projects are so capital intensive and time intensive, we wanted to create a space where neighborhood market owners could build their skills and be able to implement healthy food changes in their store environments on their own. So we have a series of trainings throughout the year. They are multilingual, with a focus on Korean and Spanish and English language presentations. And the purpose of those presentations, as I said, is really to build the capacity of the store owners. We have workshops on product handling and storage, marketing, merchandising, store design and layout, brand strategy, and as per the topic today, how to build relationships with distributors and wholesalers. So I'll just leave it at that for my introduction to the program.
Great. Thank you so much, Claire. That was great. So I guess in your interaction with stores through the Community Market Program, as well as the trainings that you've been doing through the Healthy Neighborhood Market Network, I'm wondering if you could share with us some of the main distribution challenges that you've been seeing stores face.
Yeah, and at this point it really is anecdotal through our relationships with the store owners, although this summer we're launching a survey to be a little bit more methodical in collecting information from the store owners about what exactly they do already when it comes to distribution and what challenges they're facing. But what we see is first and foremost just a lack of information and a lack of clarity about where to get started. Many of the neighborhood market owners, they have limited time to research or build relationships with vendors. We do have a large produce terminal market, so some of them are familiar with that space and they'll go down and make deals, but because they don't have relationships with a lot of the vendors at the market, it's difficult to get competitive price points. We see the store owners are relying really on themselves and their own vehicles for a lot of the transporting of products. This limits the quantity that they could purchase. It's inconvenient, and therefore that limits their interest, especially in expanding into perishable goods. And we also see, unfortunately, and you spoke to this, Ange, that a lot of the neighborhood markets are purchasing from large retailers. So they're not even going to wholesale operations, they're going to supermarkets and are really looking for discounts and will just buy bulk and walk out the door as if they were any other customer. So really missing the opportunity to to be the retail purchaser themselves with wholesale and distributor operations.
Thank you so much for sharing that. And so I think one of the strategies that you've talked about and that we've discussed in this presentation is about partnering with distributors. And you've had some interesting ways of partnering with distributors, both in terms of training as well as developing information for store owners about where to purchase healthy foods. And so I'm wondering if you could talk a little bit more about the work that you've been doing to address some of the challenges that you've just laid out.
Sure. Yeah. So we're trying. Our approach is that we would like to pre-broker arrangements and agreements with some distributors in our area on behalf of the cohort of stores that we're representing, and figure out with them, collaborating, how we might expand the access on the part of the store owners into distribution infrastructure that's already existing. And it's definitely looked like partnering. And the way specifically that's actualized is through the training space, where we have, I should have said earlier, we have a network of about 150 neighborhood markets that have been touched by our trainings. On average, we have about 70 store owners that attend, and most of our presenters at those trainings have been representative of wholesale companies or distribution companies who are willing to share their expertise and their experience as industry professionals. Fortunately, because we find a lot of these folks through the Food Policy Council, which is already intended to be a big tent operation bringing together folks from the private sector, the public sector, the nonprofit sector, we're attracting individuals within these companies and entities who have a heart for food access and equity issues and are looking for a way to share their skill set. A lot of times they also see it as a business opportunity. They want to have more direct access to the neighborhood markets. They want to learn more about what their needs are and what their challenges are so that they can think through how they might be able to better serve. So that's one of the main ways, is through the Healthy Neighborhood Market Network training series that we've engaged distributors, is just to come as presenters. We learn a lot from them through that process, because then we're able to dialogue about, what do they see as the issues and what skills would they like to impart. And then the other project that we have is we're putting together a vendor resource guide for the stores, and that is basically a profile of the 4 distribution entities we've been able to do that pre-brokering work with. Unified Grocers, which you spoke about, Ange, is one of them. Fortunately for us, the Unified Grocers entity in Southern California was already very engaged in this work through the California FreshWorks Fund. They were brought to the table to look at issues, what the challenges are in food desert communities in Los Angeles and Southern California broadly. So they were already aware of the issues, and because of their neighborhood market program, they understood that there's an untapped market potential here. So we didn't even need to make the business case to them, although that would be one of my main pieces of advice is when dealing with wholesalers and distributors to really communicate with them about the market potential, the way that they might be able to expand their business. Unified Grocers already understood that. They were the ones showing us a map of neighborhood markets throughout LA County and talking about $200 to $300 million in potential sales for their neighborhood market program. So that was an easy partnership because we realized that we need each other. We representing the Community Market Conversion Program need better access to distributors, and a distributor like Unified Grocers, they need help organizing neighborhood markets to understand what their services are and how they can best tap into them. So in our vendor resource guide, we profile for distributors. We talk about the products that are available, what the logistics would be in terms of ordering, if there's a delivery fee, what that is, if there's a minimum order, we describe that, if regular orders are necessary to have an ongoing relationship with the distributor, and then if there's any additional benefits. So for example, another distributor that we're profiling is Community Services Unlimited, which you also mentioned. And Community Services Unlimited is a South LA-based food justice organization that aggregates what they grow in South LA with other regionally grown organic fresh fruits and vegetables. So when you're buying from Community Services Unlimited, you're really not just purchasing the produce, you're also investing in jobs for young people, and you're investing in all of the incredible community-based health and gardening programming that CSU does. So we want to make it clear to the store owners that they do have options, and that's first and foremost what we want to impart to them is whatever their priorities are, whether it's price, quality, if they want organics, if they want to invest locally, there are entities that are ready to work with them that can provide them that range of auxiliary benefits to their purchases.
That's great. Thank you so much for sharing about that work that you've been doing with distributors. As a follow-up question, and I know that you touched on sort of one piece of advice, which I think is really important about making the business case to distributors. But I'm wondering if you might just be able to briefly just talk about if you have any additional tips that you would give to people in terms of initiating relationships or maintaining relationships with distributors.
Well, I think that working through an entity like the Food Policy Council or even the office of an elected official in your area is another great way to have sort of an outside third-party entity create a context for that relationship to take place. With other distributors and wholesalers who I've reached out to, because they're not already in the Food Policy Council network or familiar with what it is we're doing, supporting neighborhood markets in low-resource neighborhoods, it's a little bit difficult to place us, right? We're not industry people calling them about a transaction. We're a nonprofit group. We're trying to create social change, and we found in our experience it's been great for an organization like the Food Policy Council, or because our Food Policy Council is associated and incubated by the mayor's office, to have that relationship as well kind of opens up doors and brings people to the table. And once folks are at the table, then a lot of information can get exchanged and we learn from each other. And that's my other sort of takeaway from relationship building is giving distributors, especially, there's a lot of folks who have been in these companies for decades, multiple decades, and many times they're family-owned, multiple generation family-owned businesses. So giving people the opportunity to mentor and to share their expertise and their leadership and to really acknowledge that, I think has really opened up a door, because then people feel really useful and they realize that what it is they're doing can have a greater impact. And so on the one hand, there is a business opportunity for these companies, and on the other hand, this is a part of their charitable work in the world, really, that they can be a part of a larger movement for changing the food system. And I find that a lot of the distributors we're building relationships with, they care about that once they're clear on what the big picture is.
I think that's a great and inspiring note to end this on, and I'm thinking maybe we can get to some of the other questions or points during our virtual office hours as we continue this conversation. So thank you so much, Claire. That was wonderful.
Great. So thank you, Anne, Claire, and Lindsay for a wonderful program. Before we transition over to the virtual office hours, which we hope you will all be able to join us for, we wanted to highlight a couple more resources. As we mentioned at the start of the call, ChangeLab Solutions is one of the co-conveners of the Healthy Corner Stores Network, which is just a really great sharing community that has a range of resources on their website. We also wanted to highlight again, the Green for Greens guide on our website, but also Health on the Shelf, which was recently released. It's a guide to healthy store certification programs. So kind of a soup to nuts, here's how you think about how all of these things intersect, not only the distribution, but also outreach, developing strong programs, and agreements with stores and various partners. Both of these are available on changelabsolutions.org. So you may have already seen in our chat box there was an announcement for a phone number for you to call in if you would like to join the virtual office hours and be a vocal participant. Those of you who are multitaskers may have already dialed in, but if you need the number again, it is 800-901-3958. So if you're dialing in or if you're listening via your computer, you will not be able to participate in the discussion. But if you dial into this 800 number, then you will have the ability to speak and discuss with us further. So for those of you who are joining us for virtual office hours, we'll spend the first couple minutes just with a couple of these questions that came up in the chat box directed towards Claire and Lindsay. And then we will be going over some questions that we sent out yesterday through our self-assessment tool, Digging Deeper. So we'll give you a minute to dial in there. And then before we transition over to that, I just wanted to make sure that you also had our information if you would like to follow up for more information or resources. We're happy to connect you with various resources and people that we know. So for those of you who are sticking on the call for virtual office hours, let's take a few minutes and just answer some of these questions that have come in through the chat box. We've had a lot of people who are interested in issues of demand and outreach, not only to the store owners, but also to the larger community. So here's a question for Claire Fox. So you had mentioned a series of trainings that you're putting on through the Food Policy Council, and what is the attendance like for some of these trainings? And how do you deal with the issues around getting store owners to engage when they have so much on their plates already, and sometimes they can't even find the time to get away from their stores, especially if they're one of the only employees? So what are some of the strategies that you use to really get them hooked on your trainings?
This is a great question and definitely a big challenge that we faced. As I mentioned earlier, we typically have about 70 store owners attend each training, but our audience is larger than that. We're having in the range of about 120, 150 folks turn out, and a lot of them are actually community nonprofit practitioners who are just getting started with their Healthy Corner Store work on a neighborhood level and are looking for greater insight into the minds of the neighborhood market owners and sort of what their business concerns are. And we definitely have the issue of convincing people to step away from their very busy schedules, and some of them just aren't able to do it. But I think the way that we've been able to invite people to take the risk of taking a little bit of time off or figuring out staffing is to really emphasize that this training is about building their skills as business owners and about growing their business and improving their business so that they're able to hopefully attract more customers, hopefully attract or grow their sales. We can't make that promise, but we do try to build these trainings as business development first and foremost, and I think that's been really attractive to the store owners. And we've also played with the idea of doing trainings either by visiting, sort of a mobile model of visiting stores, or working more directly with some of the merchant associations. So for example, we did have a training in March that was focused on Korean and Korean American store owners, and there are several pretty well organized networks of Korean merchants and neighborhood market owners, and so presenting to them as a whole group during their monthly or bi-monthly meeting has also been a good way to build relationships and to reach multiple store owners at one time.
Great. So it sounds like you've had kind of a very long-term vision in terms of building relationships with the store owners that happens way before you're recruiting for the training.
Yeah, and we try to describe this as a network that they belong to and that they can derive resources from. So the Healthy Neighborhood Market Network is really intended to be an association where neighborhood market owners can network with each other. So there's peer learning, but also that they can network with industry professionals. And at our inaugural training, which was last summer, we had folks from Whole Foods, we had folks from other pretty brand name, well-known companies, and I think that was very attractive as well to the neighborhood market owners to feel like, wow, okay, great, well, I'm getting access to some real industry professionals here. So I think that's really important because we've done it also where we bring in our friends and partners from the nonprofit advocacy or public health world, and I think those can be very powerful and impactful presentations as well, but they don't seem to have the same traction as when we bring in people who are in the private sector and are talking about the bottom line, quite frankly. So obviously we work closely with our presenters so that they understand the big picture of what our mission is, and that we are trying to expand access to healthy foods, and it's not about profit by any means necessary, but really about growing their business as healthy stores. And so they're able to dial that message into their presentation. But at the same time, they are really representing the business sector, and I think that's really important.
Great. And to follow up for both of you, so in terms of also outreach to distributors and kind of showing that there's a business demand for them, what are some of the strategies that you found most successful in trying to reach out to them?
Trying to reach out to the store owners?
To the distributors to show that there's a business link for them, that they could also potentially grow their business and reach new markets.
Well, I think that with a little bit of conversation, everyone gets clear on how the small independent corner store operators or neighborhood market operators are not necessarily well organized, although there are some merchant associations. As a sector overall, they're not very well organized, which makes it very challenging, I think, for distributors or wholesalers to imagine the possibility of expanding their reach or expanding their services and products to that sector. So there's both ways. There's a lack of information and a lack of clarity. And so what I think is attractive to the wholesalers and distributors is that we're doing the heavy lifting of organizing a network of neighborhood market owners who are coming to those trainings eager for resources, eager for business opportunities, and looking for vendors. And giving them, the distributors, the platform not just to present, but to have a table with information where they can exchange their cards, etc., I think has been really beneficial for them. And also, long term, we're thinking about and wondering about the possibility, and this is our purpose in doing this survey this summer, about cooperative purchasing and leveraging the Healthy Neighborhood Market Network as sort of a buying cooperative. And that makes it a lot easier for distributors and wholesalers to think about interacting with an organized entity of neighborhood market owners. And then this, of course, connects in with some of the food hub work that's happening locally. So as certain missing elements of our distribution infrastructure are starting to cohere and organize themselves through efforts like ours, I think that brings distributors in a little bit closer, because then it becomes easier for them to understand how they could best plug in.
Great, thank you. And I think that with both programs, yours and the Central Kitchen program, that lack of that information gap, it sounds like it's just as critical as the actual infrastructure gap in many cases. Lindsay, was there anything that you wanted to add about the topic of building demand, both on the store owner side or the customer side?
Sure, just to piggyback a little bit off of what Claire said is because we are the actual customer, our distributors are not going to the corner stores. If anybody is interested in that, though, our large-scale distributor of produce is actually interested in working with us to see if there's a discount program that we can work into it to actually lower the price of the produce so that the demand is a little bit higher on the store owner side and then the customer side. But just a little bit on that too is getting all the information together. We try to, all of our corner stores we want to have in the program or that are interested in the program, we definitely go out there and do some assessment and some evaluation. But we also try to keep them fairly consistent in one area. So as we, being the distributor, we're not taking too many runs, again, in the middle of DC traffic Monday through Friday up to places in and around the district that don't make sense. So as the distribution hub, essentially, we want to make sure our routes work really well together. So anytime a new store is added, we just pick a particular delivery day that works best with that route, whether it's a northeast, southeast, northwest, or southwest DC.
Great. So if I haven't seen any more questions come in through the chat, but if the people who are still on the call have any further questions, please feel free to continue asking those. You can also, if you haven't already, dial into the virtual office phone number, which is 800-897-4933. And we're actually going to switch gears now to thinking about the stages that we outlined earlier in the presentation about taking those steps towards creating a new distribution landscape or connecting with the existing channels. So you should have received via ReadyTalk an announcement to download a self-assessment tool that we're calling Digging Deeper. And basically it follows the 4 sections, the 4 steps: assessing your stores, assessing your supply chain, gathering allies and resources, and then developing healthy food distribution models. So we're not actually going to go through all of the questions now, but we thought maybe we could use those 4 stages as a frame for our discussion right now while we have our experts on the line. So for the first step, assessing your stores. And I just wanted to do a little check. Do we have people who have dialed into the office hours line?
Have people who have dialed into the office
so just a reminder, if you are dialing into the phone number and you're not speaking, you can put your phone on just speak about that noise. But feel free to question or to respond to unmute your line. So it sounds like we have some people who are able to join us. So for the first step of this self-assessment tool, assessing your stores, we just wanted to open up the phone lines and see if there are questions that people have about the store assessment process, or even perhaps best practices that you found yourself through doing this in your community. Anyone want to jump in? This is a bit of an experiment since we know that there's over 50 people on the call still. People are feeling a little bit shy. You can also use the chat function if you don't want to speak, but you do have a question or a contribution to make. All right, Lindsay and Claire, is there any tips that you want to share about the store assessment process that you think would be very helpful to these folks?
Well, one of the questions that the distributors have asked us, and again, this circles back to the survey we're doing and trying to be more methodical about the information that we're collecting from the store owners. But there is the question about, well, how much product are they looking for exactly, right? And so I think getting back to this idea of demonstrating the business case to distributors, it is important to get a sense of how much product the stores are moving in terms of perishable goods or other healthy food items, or what their goals are. and what they think is feasible, and you could think of it in terms of phases, phasing in new products over time, kind of helping them, coaching them to set some goals. And that information is helpful not just for you and the store owner to get clear on the goals, but also that's data that can be, in the aggregate, really attractive, I think, to distributors and say, look, this is what we're aiming for, this is where they're at, and this is where we're headed through this Healthy Corner Store program. And then you're able to kind of demonstrate to a distributor what it might look like, and that gives them a sense of how they might be able to best serve that sector.
That's great. The idea of phasing, I thought that was a really wonderful part of the DC program, just creating a way to shift over to a new business model, and that absolutely seems to work in various aspects of Healthy Corner Store programs. There's a question here that I just wanted to highlight about tobacco and alcohol distributors because Ange, during her research, found that a significant portion of profits that store owners get is from these distributors. Did you, Claire and Lindsay, find that to be a barrier in the stores that you work with?
Yes, at least in DC, very much so. DC government has not super specific kind of verbiage for what's considered in their business license sector, what's considered a small store, a large business, what's considered a retail vendor. So it's very difficult because a lot of our corner stores carry alcohol and tobacco. The only thing that cannot be sold in most stores in DC is hard alcohol. So beer, wine is permitted in almost any type of store, everything from large scale grocery stores down to a Panera. And then same with tobacco for the most part for the corner stores. So we find a lot of issues with people coming in, going right up to the register, getting tobacco over the counter, and then also space. Most of the corner stores don't have very much space in the front of the store or as far as signage, either hanging or on the walls. And most of that is taken up by alcohol sales and then a little bit more by tobacco. So we've actually tried to work with stores that have some front counter space to put some signage up there or to actually remove one of the alcohol or tobacco signs from the front of the store. And we have window clings. We have a great relationship with the DC Department of Health. They have some funding through some of their own grant programs. Not necessarily in food access, but in decreasing obesity. That's one of the big initiatives. So we're able to actually use some of that grant funding to do marketing. And one of the products is hanging signage in the stores to point in the right direction of where our product is, and then getting window clings for the front of the store. Very simple, but to stand out among the other signage for the alcohol and tobacco.
That's really great. I see some other questions that are coming in that are kind of getting to this next step, so maybe we'll just jump there now that we're thinking about kind of what the solutions are. So assessing your supply chain, so we're hearing that the distributors themselves who are selling unhealthy options are pretty assertive. And they can rent display and promotional space, and part of what you're doing is trying to create healthy options and alternatives to that and showing that it's financially feasible. So in terms of kind of bridging that gap, now that we have kind of, once you've made it through the assessment process, what are the questions that you want to then ask about what skills are needed to access the supply chain, what sorts of training is needed, and sort of how can we, have a paradigm shift towards healthier foods? So if there are any responses from the line? Here's a question that's coming in for Claire. So when you're working with United Grocer to drop their minimum order fee significantly, what were some of the strategies that you used? Here's a person on the line who has been working in Connecticut, and they are having a hard time convincing them that making this cut into their profits will be good in the long term.
Yeah, it's a great question. We didn't actually convince them at all. They had already had, at the point that we got in touch with each other, they already had their neighborhood market program, and they had various iterations of it. And I don't work for Unified, so I can't tell you the whole history of how they determined that that was a good business move. One thing I wanted to clarify from what Ange had said, it's they do have a minimum order. It's $500 minimum order per category, so it's actually not per week. A neighborhood market owner could make an order with Unified Grocers once and that's it, or they could do it once a month or every other month. I mean, it's really up to them, but per category, and they have different product categories, and they actually don't, through their neighborhood market program, they don't offer every single product category, including produce. They actually don't include produce as a product category in their neighborhood market program. So that's a limitation right there, right? And that's why we look to people like Community Services Unlimited or other distributors who are willing to do the produce piece of it. So in terms of how it penciled out, it obviously didn't make sense for them to do a minimum $500 purchase order within the produce category for small stores. But they were willing to do it for their other shelf-stable grocery products, for their frozen and deli categories. And I think that their vision overall is, the way that Unified works is that they're actually a cooperative. They're retailer-owned, so they're owned by fairly large independent retailers to be their own distribution arm. And it's you have to own a share of the company to be a member. And what they wanted to do was expand their business offerings to stores that wouldn't be able to purchase stock in the company. So you don't have to be a member to participate in the neighborhood market program. And I should say that some of the stores that they're working with in this, what we might think of as like their small store category, they're not actually very small. They're grocery stores that don't have the ability to become full members, full paying members of the cooperative. And then there are some really small stores too, including some of the corner stores that we work with. So I think that their strategy overall, and I don't want to speak for them too much, but is that they see this as in the aggregate, when you have enough customers within this category, it does pencil out. But the key is economies of scale. And they're tweaking it too. They're trying to figure it out. But they're committed to figuring it out because they've identified that there's basically an unserved market, which is true. And that's the whole context of this conversation, is that there are all these small retailers. And when we say small, I mean it's really a range, small to mid-sized retailers, that are currently not being serviced by the mainstream distribution infrastructure. So Unified Grocers is basically trying to figure out how they can do that.
That's great. I mean, I think that really underscores the reality that they have a business too, and so I think the success from LA is really finding a way to show that there is the untapped market and there is an opportunity there. So we've been talking a lot about this kind of throughout, is the idea of gathering allies and resources. So I'm wondering, Lindsay and Claire, if there's any other tips that you wanted to add that we didn't cover earlier about who you might reach out to help kind of bridge this distribution gap.
Yeah, I could weigh in. I think that if there's a terminal market in your area, if you're located in a larger city, connecting with the manager of that terminal market and asking if they wouldn't mind giving you a tour of the market and introduce you to some vendors. A lot of relationships have actually been created by sending out graduate students who are doing research on the distribution sector in our area. And frankly, I think there's sort of a student's privilege where, they're sort of non-threatening, they're just trying to learn. And it's been our experience, myself previously as a graduate student, and then later professionally working with graduate students, that they're able to open up doors that might be a little bit harder for practitioners to open up right off the bat because there's this interest in supporting young people in their learning. So that's one way we've learned a lot about our own local sector is actually by partnering with graduate students and giving them meaningful projects for their either client project or their thesis project or what have you. And then they're out there, walking the floor at the terminal market, creating those relationships, picking up business cards, and kind of giving us an assessment of who seems open and who would be a good ally, and then we could do those follow-ups. So that would be another one I would add.
That's great. Claire, is there anyone else that you wanted to add? Oh, sorry, was that Claire? Oh,
it was, yeah.
Yeah, I just wanted to also give a plug for Ange, who as a graduate student did do her thesis on distribution, and she has very graciously offered to make that available. So if you'd like a copy of that, please feel free to email us. Lindsay, sorry, I didn't catch the difference in your voices. Lindsay, was there any other potential partners that you wanted to speak about?
That's okay. Usually my thick Jersey accent shines through. But yeah, actually that Claire's comment was dead on to what I was going to say is we have a great relationship with some of the universities and colleges in the area. Because DC is so small, we have some outside scope into Virginia and some Maryland folks as well. And we've had some great students, dietetic students, graduate students come in and not just go out there and be kind of the source into the community, but also a source other places as far as doing customer surveys, getting out and serving the store owners as well. I think that kind of takes a little bit off of your shoulders and then really gets a different bird's eye view of kind of what's going on out in the community that you might not see. Some of our students have even been, folks living in the area and on SNAP benefits themselves. So it really gives a good overview of some of the other things in the program. For us also, it's working with other nonprofits in the area that if they're not doing the same thing but have a similar mission. And again, one of them actually wrote some of the information for the original grant to give to the district. So we've been able to actually work with them afterwards to do some evaluation of the stores, but then also connecting us to some of their partners as well. And again, DC being so small, we have relationships with most of the sectors of DC government. 10 square miles gives you very little space to hide, so we're able to work well with them and to get our name out there, and then that actually just expands the program in and of itself.
Great. Yeah, I think that it sounds like both of you have really assessment built throughout the process and a great feedback loop with different partners. So we have just a couple minutes left, and Lindsay, I'm wondering, since you've really a big focus of your program has been to build this distribution system from the ground up. Are there any other tips that you wanted to offer during this last stage of the process where you've taken stock of what resources and partners you have and what your existing distribution landscape is, and you're trying to figure out what models you're going to use to fill that gap?
Yeah, I think one of the things we've learned is not just doing Healthy Corners, but many of our other programs, is it's okay to fail. It's okay to not necessarily do things the best the first, second, or even third time around. But actually being able to show where you can grow and grow the program. A lot of funders want to see that. They don't want to see that you can do it perfectly the first time around. They'll actually extend your funding through different organizations, and then showing that you are looking for funding, that you are looking for next steps. I think for us, we had a great relationship with DC government and the local and small business development, which is actually one of the funders, since many of the corner stores are small businesses. They're not large-scale chains in the district. So really working with both of them, we learned how we wanted to do things outside of the grant phase and maybe taking things into a bit of a different scope, but really having that relationship with the different partners in and around you, but at the same time just really being able to take what you want to do and move forward with it. And surprisingly, this has worked, and a lot of times things that don't seem like they should work do work, and we've been able to build some really wonderful relationships. We're working with some colleges and universities to do research into food access and obesity issues, and that wouldn't have been even close to possible without kind of taking a chance on what we thought was something the district needed, but we just weren't sure if it was going to work or not.
That's really a great lesson, and I think one that is great to end on. You know, the work that both of you are doing is so inspiring, and to hear that, you know, you're allowing yourself to take risks and to experiment with what works is, I think, really great for all of us to hear as well. So thank you both so much for sharing your expertise. And thank you to everyone who stayed on for our virtual office hours. And we hope that you'll be joining us for our future New Carrots on the Block webinars, which will be coming up soon. So please, again, feel free to reach out to us if you have any follow-up questions or want links to different resources, and we will be in touch with all of you. Great. Thank you, everybody.